Hi, I'm Dr. John Young with Foundational Health Center here in Largo, Florida, and wanted to just kind of give you an update. You know I've been doing a lot with Enbrel, E-N-B-R-E-L, a drug that you see advertised on television for its use in psoriatic arthritis, autoimmune conditions. We're using that drug once a week for years to kind of help alleviate a lot of the signs and symptoms of psoriatic arthritis, some of the autoimmune conditions. But there's been some interesting articles out there looking at the use of this drug in kind of a 1 or 2 time use, just once or twice, because one of the interesting things about that drug is it has a very unique effect on the brain. It seems to stop inflammation very, very quickly. And they've looked at it in any type of brain injury, in post-traumatic stress disorder, in depression, Down syndrome. They've looked at it at a lot of neurological conditions. And there's been some interesting reports. So I just wanted to report to you that we've been using it more and more in my practice. The side effects, we'll start off very quickly, is I don't really know, because all the side effects are based on using this drug week after week for a year or so, and it does depress the immune system. If you're using it once or twice, really doesn't seem to have any depressive effect on the immune system, so we really can't say, but you're using it only once or twice. And I've had a number of patients lately who have come in and they've had multiple sclerosis, they've had chronic pain, they've had strokes, some with just depression and all of that, and they're coming to the end of the rope. They're like, John, the drugs just drive me crazy. I can't take them. I have no zest for living. I would really just like to just call it quits. And so I've talked about some of the studies. It's an off-label use of this drug, and want to report that the results we've been getting with our patients is very, very interesting. Probably about an 80% success rate. And I think a good illustration was I had a person with multiple sclerosis, and I gave the drug hoping that he would be out of the wheelchair. And so we gave it to him. You give it just subcutaneously right under, I go about C6, C7, right under the skin there. And then you lay them flat but downward, so the drug then goes right into the blood-brain area, right into the central nervous system. And I was kind of disappointed when he came back a couple weeks later, because he wasn't walking. Now, he had more use of his arms, he was just showing me raising his arms. He couldn't do that before. But here's the thing he talked about the whole time. John, my whole mental attitude has changed. It's just great to be alive. I know I'm not walking, but I am honestly, I feel like it's just, my whole mental attitude has changed. A really upbeat guy. And before he was just blah. And I've had several patients, in fact, I just had one today, remind me that why I wanted to share this with you, is a woman she's 90 years old. And she knows she's getting older and she's slowly wearing down. And so I gave her the Enbrel. And she came in today, I gave it to her last week, and just a completely different person, just saying, John, ever since I got the Enbrel, completely changed. Life is wonderful. And it's just great to see how this has changed this lady. Reminds me of a guy that I did it to about a year ago, and here a year later, and he's still this upbeat, life really is good. And I think we don't realize how inflammation can cause a lot of problems in a person, in the mental aspect. Because depression, just kind of the living with, as we age, the body still starts to break down. And when you have the breakdown of the body parts, you have inflammation. And it's interesting to see when you stop this inflammation, it's amazing how for people with a lot of depression and that zest for life, it goes away. So it's something you may want to think about for a loved one or for yourself, that Enbrel subcutaneously may be an option where you aren't yourself again. And it may be something you want to talk to your doctor about to see if you can't get that zest for life back.